In the Guéré Clinic in rural Burkina Faso, the waiting room is packed. Nurses rush between benches, and patients wait hours to be seen. Facilities like this face a crushing reality: the double burden of disease. They are treating immediate infectious threats, like malaria, at the exact same time as managing rising chronic conditions, like hypertension. The sheer volume of patients quickly overwhelms limited supplies. When a patient finally sits down with a doctor, their medical history is usually trapped in a stack of fragmented, handwritten paper files. Finding past lab results or allergy warnings takes critical minutes, delaying life-saving decisions. Then, the municipal power grid fails. If this clinic relied on a standard, cloud-based electronic health record, that blackout means a total system collapse. Without physical power, the local internet router dies. Without the internet, the connection to the cloud is severed, and every digital patient chart instantly vanishes from the screen. When the digital record is functionally inseparable from the local grid, the patient's data is only as reliable as the power outlet. In this environment, an unreliable utility makes the data system a liability. This vulnerability drove the Burkina Digital Health Initiative to deploy the Sankofa Global Health Platform. Sankofa is an offline-first facility operating system engineered specifically to maintain performance even when local utility reliability drops to zero. Instead of relying on a distant cloud, Sankofa shifts to edge computing. A physical server rack, an AWS Outposts unit, is deployed directly inside the clinic. Because the core clinical database, powered by OpenMRS, lives entirely on that local server, doctors never lose access. The power goes out, the internet drops, but the patient records remain fully accessible on the local network. Providers navigate these records using a progressive web app. It caches locally on rugged tablets and features a language layer that lets doctors instantly toggle between French and regional dialects. This diagram illustrates the offline AI triage kiosk. A patient inputs their symptoms on a touchscreen. That data routes to local AI middleware hosted entirely on the clinic server, which bypasses the internet completely to calculate an emergency severity index score. By cutting the tether to the outside internet, the facility secures true data sovereignty. The clinical care never halts. Software is only part of the equation. To stay operational during a blackout, the facility must also maintain visibility over its physical life support systems, the power and the water. The Facility OS dashboard uses localized cron polling, a method of automatically requesting status updates from connected devices at scheduled intervals, to pull live data from the hardware. The system continuously monitors the flow of electricity from the solar arrays, the water levels in the atmospheric water generators, and the exact charge remaining in the high-density battery storage units. The platform handles medical diagnostic hardware differently. Devices like the Abbott iStat handheld blood analyzer use an event-driven model. Instead of the server asking for data, the device pushes the data out the moment a lab test finishes. A dedicated listener program on the Edge server catches this incoming payload, formatted in standard HL7 medical protocol, and injects the blood test results straight into the patient's local chart. If that blood work shows a dangerously low hemoglobin level, the automated injection triggers an instant red critical alert on the attending provider screen. Looking at this architecture map, the left column pulls infrastructure telemetry, the center catches pushed clinical diagnostics, and the right manages AI triage. Across the top, the Starlink Bandwidth Manager prioritizes life safety clinical data over administrative syncs or hardware telemetry. Sankofa operates as a central nervous system, binding together off-grid life support and complex medical diagnostics into one localized hub. Eventually, the blackout ends and the clinic's satellite dish reestablishes an internet connection. This triggers the platform's hybrid open-source architecture. While frontline care runs on OpenMRS locally, national health reporting relies on a different system called DHIS2. The moment the Edge server detects the active connection, it encrypts the backlog of new patient records and silently begins syncing them in the background. As this map shows, the data from the isolated clinic translates securely upward, feeding directly into the national DHIS2 reporting system and the government's ENDOS patient registries. For the Ministry of Health, this automated aggregation provides exact, real-time visibility into regional disease patterns. They can track a spike in malaria cases instantly, rather than waiting months for a paper report to arrive in the capital. By securing the most isolated rural endpoints first, you lay the foundation for a truly resilient national health network. The Gary Clinic has moved past paper files and localized blackouts. By anchoring its data to its own energy and water infrastructure, the facility remains functional through the very outages that used to paralyze it. The Sankofa platform gives providers the exact tools they need when they need them, ensuring consistent care for patients everywhere. Sankofa Global Health, connecting data, elevating health.